where we have the opportunity to hear the point of view of businesses. Here we have Xavier Castillo. He is the Barcelona branch manager responsible for the electronic industry market at Ametic, the Spanish information communication technology ICT trades. We have with us Angel Lanunza, is correct, the Spanish Healthcare and MedTech Technology Platform Coordinator, and Rocho Arroyo from Amedix. She's the CEO of these companies that has awardee a PPI implemented by Galicia. But I ask you, so I would like to give the floor and get the presentation of Xavier Castillo as first. And I would like to ask you how you consider PCP and PPI, and what do you think they could be? They are good approaches that could be beneficial for SMEs, for ICT industry. So let's get to your presentation.
Okay, thank you very much. Thanks the organizers for inviting us to expose our view on, mainly on public procurement of innovation. Okay. Now, Ametic is the Spanish ICT, there is a mistake, Information and Communications Technology Trade Association in Spain, and it represents the legitimate interests of the electronics industry, information technology, telecoms operators, and digital contents and services. Now, Ametic supports public procurement of innovation as one of the best ways to support the European ITC industry. And by public procurement of innovation, I mean when a public organization becomes the first buyer or a lead user of a scalable product or service that later on will grow into a reasonable business in the marketplace. Okay? Now, I'm familiar with Ramon Maspon's work and the success stories that will be explained later on in the health industry. Unfortunately, in the ITC sector, in Spain and in Europe, things don't look so good. Here in Ametic in Barcelona, we can go back as early as in 2009. We organized the first seminars trying to teach the public managers in the Generalitat de Catalunya how to use public procurement of innovation at that time. It was called Compra Pública de Tecnología Innovadora. I'm sure you will remember that, after the work of Fundación Cotec. Nothing much happened. We were very happy in 2011 when the Spanish government announced the intent of spending 3% of all purchases done by the central administration to be spent in innovation procurement. Unfortunately, it did not happen. That was only an expression of intent only. And I doubt if now we are at 1% at most of all the purchases that relate somehow to innovation. But the situation in Europe, well, that's the ITC market in Spain first. And it's been shrinking for the last years. Here we have the evolution of 2013 versus 2012. The ITC market in Spain contracted by 2.1%. In 2012, it had contracted by 5%. And in the last 6 years, the ITC market in Spain has contracted by 18%. Okay? But in Europe, the picture is not much better. These figures were presented by Ametic's president in Santander last September. In Europe, we have the situation where, I'll read the numbers for you. ITC sector worldwide is growing in North America 2.8% in 2013, is growing in Latin America 6%, growing in Asia more than 5%, growing in Middle East 8%, shrinking in Europe 0.8%. Okay? Shrinking in Europe. It's not only Spain. And it's the result of a series of waves that we have been witnessing during the last decades. We saw how mainframe computers were replaced by departmental computers, which in turn were replaced by personal computers, which were left obsolete by smartphones and tablets that will be replaced by who knows what in the future, but they will be replaced and they will be left obsolete. And it's not only the ITC industry, I mean, it's the ramifications that the ITC industry has in other industries like photography, for instance. Germany used to be one of the leading manufacturers of cameras. No longer. One of the leading producers of film was Belgium, Agfager. Doesn't exist anymore. Today, digital photography is a business of Japanese manufacturers with American software, essentially. The music industry, it has changed completely. Today, if I want to purchase music, even from Catalan composers like Montpou, very often I have to go to American portals to get this music. Okay? So the European industry is nowhere to be seen after all these waves. Okay? If we look at the top 10 software companies in the world, only one is from Europe, SAP. The rest are all American. Okay? So it's clear to me that Europe needs a new strategy to lead some of the future high-tech markets. Okay, these are gone. Okay, these we have no choices anymore. But the European Union needs to learn how to shape new markets in order to drive innovation. And this has to be based on companies introducing new products and services with the help of public organizations. If you don't understand what I'm saying, please read this book, The Entrepreneurial State by Mariana Mazzucato. Okay? Here you will learn in detail how the Americans are managing public procurement and how they are managing the legal framework for their companies to be able to innovate and create new markets continuously. Let me just point out to one of the markets, SBIR, Small Business Innovation Research, which is one of the, it's explained in detail in this book. And after hearing some things in the room before about targets, since 1997, the federal government, the spending has targets on how much money federal agencies have to spend to help innovative SMEs, small and medium enterprise. In 1997, they started with a target of 2.5% of the budgets of federal agencies. They're increasing that now to 3.2% after 2017. Intellectual property, all the money spent by the federal government in companies, the company owns the intellectual property and all commercialization rights, period. There is nothing to arbitrate. There is nothing to decide. And the purpose of the program is, it was created to support scientific excellence and technological innovation through the investment of federal research funds in American priorities to build a strong national economy, one business at a time. Okay? And that's only one of the programs described in this book. Okay, so please, if you are not familiar with it, go to a library and get it as soon as you can. The good news is that it's not over. I mean, thanks to Moore's law, technology is renewing constantly, and there will be new businesses that will kill the businesses that we are witnessing. We are seeing a new business emerging based on wearables. The ultra-high definition TV and the implications it may have on contents producers. And I'm convinced that the Internet of Things will be the basis for a wide revolution in the coming years. Now, is Europe going to be leading one of these markets? Not if we continue doing things like we have been doing until now. We need to take fast decisions, very aggressive decisions, at least to try to catch up with what's happening in Asia and what's happening in the United States. If not, all these programs we hear about, like the Digital Agenda for Europe and things like that, will be executed, purchasing Asian manufactured hardware that runs American software to access American contents. And in this value chain, Europe will not be present. I'm optimistic it's still possible thanks to this constant renewal. The ITC sector is the best example that Schumpeter's creative destruction theory is true. It happens every day, but we need to take decisions fast. Thank you.
Effective and short presentation. I would like to reserve time to leave room for questions from the audience. And now I would like to ask to Angel Lanunza to introduce his presentation.
Well, first of all, thank you very much for the organization for inviting us to share our vision with you. Well, I have 34 slides, but I'm going to be very quick, so don't worry for that. People that knows me knows that normally I try to go very fast. So, well, as I've been introduced, I'm Angel Lanunza. I'm coordinating a national initiative in the field of medtech. I don't know how many of you are familiar with the sector, but medtech sector or medical technology covers from in a hospital from a strip to a magnetic resonance imaging equipment. So it's a very deep and huge sector. I also work in FENIC, which is the trade association. We are we work close together with Ametic in different fields. And if you have noticed my first slide, I'm talking about converging technologies, and it's because the medtech is one of the fields that all technologies can converge. All things, materials, TICs, nanotechnologies, robotics, software, is everything related to the medtech, because every technology is involved in the development of our services and our products. Which is a technology platform and why we are here, why we believe the commercial procurement is helpful for the companies. Well, we have been discussing these last 2 days in Madrid in our 8th conference of innovation in biomedicine, the problems that we have and the strengths that we have in the country. We have noticed that we have a very good strengths. We are very good in research. We are very good in publications. Barcelona, for example, is top 3 world in the field of nanomedicine. But we always fail in the commercialization. We have a good sector, but it's based on small companies. Probably 90% of the companies in Spain, and probably in Europe is the same figure, 90% are small companies. And how the procedure and the purchase are related to the public sector, normally these small companies are out. In fact, we carried a survey 2 years ago about companies that were innovative, what they thought about the public procurement, and they were not interested. So the most successful and most innovative companies were not interested in how the public tenders were working, because these public tenders were not think for them, because of the volume, because of the legal procedures or whatever. They were discouraged to go there, and they were losing an opportunity. So that's why we think the public procurement could be an opportunity for them, because we have a very strong technology-based companies that are working in the sector. Spain is also one of the most efficiency healthcare systems in the world. Healthcare is a huge market. It's worth around 400 billion euros, and it's increasing. It's growing. Every year it's growing. Why is growing? Because we are living better. Oh, we want to live better. That's the point. And Spain holds the 6th position in Europe related to employment and turnover. So it's a sector that holds an opportunity. Where is the industry expanding in research? The first one, software and internet. Probably Europe is shrinking, but as Javier has mentioned in his slide, the other countries are growing. And you see, healthcare holds the 4th position. Only related to research applied in healthcare, probably more related to pharma. But if you take something from the software and internet, telecom, consumer, computer and electronics, and apply it into healthcare, probably the expenditure in the healthcare sector and the healthcare technology will be bigger. There are countries that are increasing, and I like to say that Germany, for example, has increased its expenditure, because when you're talking about healthcare companies, and not mention the typical ones that you always think about, GE, Medtronic, the first companies that always come to your mind are Siemens, Philips, Roche, well, they are close together. They are based close together to Germany. One of the issues that we hold in Spain is that, as I always like to say, sailing searching ideas can be fun, but we have a very deep problem in Spain that is ideas are everywhere, but no one knows where they are. So this is like Donald Rumsfeld says, there are no unknowns that we know, and no unknowns that we don't know. So there's huge opportunity, there are lots of ideas, there are lots of companies, but we don't know where they are. And they don't know how to reach to the market. So again, public procurement, innovative public procurement can be an opportunity for them. There are ups and downs along the trip. This is something I'm not going to spend more time, but this is a slide that I always like to share with you when I am talking in these conferences. You need a navigation system. This is very important. This is a slide taken from the FDA. Normally, when we talk about going from the idea to the market, we think on short times. MedTech is short time, sometimes. If you're talking in pharma, you know that this slide can take 10 years. There's no problem. When you're talking about MedTech, it could take 6 months, 1 year, or 3 years, or 5 years. So it's very important to understand all the different stages, because these stages are also really related to the public procurement with the times. Sometimes the companies complain about the time of the framework of the contract, because the administration probably has not taken in account that the timing to really make the deliverable to the market. Industry seeks cooperation, but changes only happen if they have real sense. So again, public procurement is a good tool because it's based on the need. There's a need. I need something that I need something because I have searched to the market and I haven't found anything that is suitable for me or really that does not cover my expectations to treat my patients. Then open innovation, public procurement. We are talking about open innovation, different countries, different companies, different sectors. And as I mentioned before, this sector is a converging technology sector. Very important for us because it's not only to grow in the health sector. We can help grow in other manufacturing sectors working together to apply the solutions and the technology in our sector. For example, nanotechnology. I have mentioned that Barcelona is the third city in the world in developing technology in the field of nanomedicine. We are, as a country, we are in the 10th position, and nanotechnology could be everywhere. It's not future. I'm not talking about future. Some of the things that are here, okay, probably you are looking very small in the letter, but some of these are real. Augmented reality, well, probably this is just past. I have just been reading a news about virtual reality, taking 3D images from the digital systems, bringing all together and making a virtual model where physicians can work with. This has just happened in the States and is in the FDA clearance. 3D printing. Yesterday we were discussing in Madrid about 3D printing technologies and manufacturing. It's not future. We showed some examples from a hospital in the south of Spain that has more than 1,000 patients, more than 1,000 patients treated with 3D technologies. And I've been discussing with some physicians and some hospitals about bringing this technology. Of course, if you go through a typical public procedure, 3D printing will not become a reality. It has to be through public innovation procurement. How the future will look? Well, this is a slide that shows, if you go from the border to the center, is more, the future is in the center. So, for example, I don't know, synthetic artificial organs, artificial limbs. This is future, but we are going in the steps. There are different groups in Spain that are holding these things. Our actions, I'm not going to spend many time because, you know, all the people that we are here today, we are trying to do research and internationalization, so helping the company's growth. We have developed different tools. One of the things I always like to point is that medical technology is still the one that more patents applies in the world. Not pharma, not biotech, just medical technology, medical devices. Venture capital, there is a table related to venture capitalists. This is a slide from the States, from the United States. I didn't have time to change it, but the last one related to the last quarter in 2014, it still holds and shows that medical devices and equipment accounts for the more volume of deals closed in the States. The second one is biotechnology. Not in this one. This is because this is diagnosis, but in the new one is biotechnology. So again, it's not pharma. Pharma is the big figures. You succeed, you invest one euro, and you can recover 100 euros. Wow, it's incredible. Medtech probably you don't have this return in the income, but you can split your risk because you can have more projects, and you can have small returns that at the end is a big one. How are doing others? I'm happy you mentioned the small business innovation research because we are trying to replicate this model. Because the small business innovation research, as Xavier says, it works very well. They also have one which is the small technology transfer research, and it's projects that has to be working with companies with a clear target to the market, that every department has an expenditure budget. For example, the one related to the national health system is around 3 billion euros per year to work with companies developing clever solutions to be adopted by the market. This is in the States. In the UK, there's the diagnostic initiative cooperatives. There are different initiatives also working, bringing from the first stage, the administration and the companies to develop these clever solutions to be adopted by the market. And then they develop the tools. And they don't have these discussions about the IPR or the taxes. They have very clear, it's to succeed and to help our companies be the most successful ones in the world. So this is how the Small Business Innovation Research works. Any clue of what or where? Well, this is how the market is increasing. And to help companies to develop these clever ideas, and probably this is my last slides, we developed what we call the Entrepreneurs Forum, the Investors for, or Entrepreneurs Forum for Investors, or Investors for Entrepreneurs, and we have bring together companies and venture capitalists to succeed to fund projects that are coming from the national system, from the national health system, for example, or from other companies. So we are acting as an incubator, and we are trying to accelerate these proposals that sometimes are coming from the public sector to turn into real ideas. And public procurement could really help these projects that we are right now funding to be adopted by the market. Because we are talking about very, very clever solutions that are not right in the market. And they have come to us because they clearly identify a need in the system, and they were asking us for money and for companies. And we succeed in bringing money and companies together to fund the project. So at the end, we were able to find the exit from the labyrinth. And I think this is my last slide. I always finish with this one, which is the hospital room of tomorrow. Some of the solutions that are here are just not from tomorrow. And this slide is for 2013, so it's just 2 years ago. Some of these have come reality today, like the smart pill or the smartphone in ultrasounds. Medical tricorder is still from futures from Star Trek, but yesterday I have a meeting with a guy from a research center in the Basque Country, and they are working on the medical tricorder. So probably in 2 years it would not be just future, it will be a reality. So please, all the people that we are today here, hear what we are saying and we are demanding, talk each other, meet your partner, which is close to you, and see what is happening around you. And that's all.
Thank you very much. And now I would like to ask to Rocho Arroyo to give evidence about the main differences in factors that could motivate for an SMEs the participation to an ordinary procurement or to an innovative procedure such as PPI. So floor is yours. I have to...
Well, thanks to the organizer for the invitation to be here today. I would like to share with you some of our experience in pre-commercial public procurement. I would say under two different hats. One is as CEO of Amadix. We are an innovative company in cancer diagnostics, and we are participating now in a PCP project in oncology promoted by Galician government. And the other hat is representing a small health cluster in a Spanish small region called Castilla y León. We've been working for a couple of years trying to promote PCP projects in this region with, to be honest, very little success as of today. So basically, what I want to share with you is my starting point is the opportunity we see in pre-commercial public procurement, the opportunity we see as Amadix, the opportunity we see as the health cluster in Castilla y León, and the opportunity we see as a bio member, the industrial association, who has been promoting also PCP in different regions of Spain from many years, I can say. So basically, we see benefits here from all the involved parties. We see benefits for the public authorities because they can drive innovation to meet their needs. So they can modernize their services, they can optimize resources and also cost savings. And we definitely see benefits for companies like mine, for SMEs, for startups, because this is a way for us to align our products with real concrete customer needs. So it's a way to shorten time to market, and for us, this is a way to start commercialize our tests in oncology in real hospitals in the short term. And for sure, we see an opportunity for patients because it's a way of improving health through innovation, implementing innovation in hospitals. So this is, I would say, the main message of my brief presentation today. This is what my company is doing. We are basically developing tests for cancer diagnostics to improve survival of patients. So they are tests either to identify the tumor earlier, as it is today, or we develop predictive tests and prognostic tests to select the right treatment for a cancer patient already diagnosed. And one of these tests is the one we are validating right now in a PCP project in Galicia public health system. This is a test for patients with colorectal cancer to identify which of them might benefit from adjuvant chemotherapy. So I would like to say a couple of things about Innovasuma, the PCP project we are participating in from last June, from June last year, so less than 1 year. And the objective is to at the end, to improve health, implementing biomarkers in hospitals in Galicia. It belongs to Innova Saúde, and I think this Innova Saúde will be explained later in detail, so I will not enter in details here, but the public procurer, as I mentioned before, in this case is Galician Public Health System. This PCP project is based, and I think it has been said before, basically in two aspects. One is the risk-benefit sharing between the public procurer and the suppliers or the companies like us. And the structure is based in a competitive development, in this case in 3 phases. I think a good thing or a good basis for this project was a project performed by ASEBIO, the Industrial Association Nacional for Biotechnology Companies in Spain. And they did a project to identify demand of innovative technologies by oncologists and hematologists from National Health Service in Spain. I think they asked more than 100 oncologists and hematologists about what do they think of the innovative technologies that companies are developing now in Spain. And I think they prioritized, and they said, we need it or we don't need it. And I think it was a tool that probably helps the Innovasuma, that is also based in other different European experiences as Silver project with a budget in this case of Silver of 2 million euros funded by the European Commission. I would like here just to before starting in the difficulties we face as a company, I would like to highlight a couple of things I think really it's a good effort performed by the Galician government before issue the PCP call for tenders, because we see that as a company, and I think it has an impact in how smoothly the process is been now, with the difficulty it has also. No? It has pros and cons, but we would like to remark that the need identification before is really necessary to spend time doing that, and also the dialogue with industrial associations to be sure if there is a technology ready to be commercialized or not, if really it's worth it to invest in R&D services, because the solution is not ready still, and you need really to develop something, let's say, to solve this exactly solution. And I think the involvement of different stakeholders, as oncologists, pathologists, ethics committees, legal department, I think at the end it has an impact when for example, companies go to oncologists to start setting up the clinical trial, or pathologists, and they are absolutely aware of what are we talking about. So I want to just give a brief idea of the 3 phases of the project Amadix is participating in this Innovasuma project. The phase 1, it lasts 1 month, and at the end of the phase 3 companies would have been selected. The phase 2, it lasts 6 months with the selection of two suppliers, and the phase 3 it lasts another 6 months. In this case, and this is just an example of a Spanish project, and at the end of the phase, 2 companies would have been selected. And here you can see the whole process on a more, let's say, visual way when it shows the 2 batches and also all the phases from phase 0 to phase 3. And the duration of each of the phases, and also the financial support for each of the suppliers in each phase. And you can see in red the moment when we are now. I mean, not only Amadix, the other 4 companies also. We are at the end of the phase 2 of this pre-commercial procurement, and we hope, as an industry, we would like this pre-commercial public procurement would be linked to a commercial procurement, so we can be sure right now, if everything goes well and we are able to validate a test, we would like, as a company, to be sure that there will be a contract at the end of the day. But as of today, at least in Spain, as of today, these 2 procurements are not linked, so this pre-commercial is independent of the commercial. I think this is changing, but I'm not absolutely sure. I think they are trying to change in Spain. I'm not sure. So maybe someone here has more information, and I would like just to give you a picture of the whole process, and just to finish my 10 minutes. Our conclusion as a company and as a small cluster, we would like to put on the table the dialogue with the straightforward dialogue with the administration, with the public authorities as a key for facilitating the projects once the call for tender is there. I think for small companies like mine, the procedure is complex. There are strict deadlines. We have many questions, legal, financial, technical specifications that need to be solved, because we are, at the end of the day, we are a 4-year-old company. We don't have an experienced administration department participating in other calls for tenders, and I think there is a lack of experience of this, not only PCP, but PPI too, so lack of experience in general in Spain, in our sector, in particular in oncology. So I think this dialogue has been a really good way. Having said that, having put those barriers on the table, I would like to insist in the opportunity we see here for the 3 parties, of course, for the industry too, to really align our products and services with real needs, and definitely for patients, for improving health, implementing innovation in hospitals. Thank you very much for your attention.